Welcome, everybody. My name is Jacob Hayavi. I'm a fellowship director in Southern California, and it's a privilege and a pleasure to have this meeting, this annual meeting about our fellowships, to give you more information about this training program. As you may know, the American Academy of Cosmetic Surgery is really exclusively devoted to education in the art and science of cosmetic surgery. And they offer many educational venues, including live surgery workshops, online education, annual forums. But I think the best kept secret is the fellowship training programs. And so today we have a few fellowship directors, some current fellows and past fellows on the panel. And we'll try and answer some questions and have a discussion about these training programs. And if there are any burning questions, you can, of course, chime in and we'll try and answer your questions. So first, what I'm going to do is I'm going to introduce the panelists, and I'll call your name, and maybe you can tell us a little bit about yourself, if you're a current fellow or a past fellow or a director, and where did you do your fellowship, or you're doing your fellowship currently, and what's your background? So just a brief introduction, and we'll start with Dr. Ayeva.
Hi, everyone. My name is Martha Ayewa. I am a cosmetic surgeon based in New York City. I did my fellowship with Dr. Hayavi, and that was amazing in 2021. Currently have a private practice, Ayewa Aesthetics, in the city that was picking up and also doing some surgical work across the country, in California and in New York. So keeping busy, doing lots of things, and yeah, happy to answer any of your questions.
Great, thank you, Dr. Ayeva. Let's move on to Dr. Ashkan Bahraini. Is Dr. Ashkan on?
Sorry, yes, I was on mute. My apologies.
No problem.
I'm Ashkan Bahraini. I'm Max Face trained. I'm currently in a facial cosmetic surgery fellowship here in Dallas, Texas, with Randy Sanovich, and loving every minute of it.
Great, thank you, Dr. Bahraini. Dr. Shayna Bawa, I hope I said that correctly.
Yes, you got it. First try. Hi, everyone. My name is Shayna. I'm a current fellow. I am here in Miami, Florida with Dr. Michael Rodriguez. My background is in general surgery, where I trained at UPMC in Pennsylvania. And so it's been a wonderful 6 months. Looking forward to the next 6 months.
Great, thank you. Dr. Karen Brown.
Hey everyone, I'm Karen. I am currently at TOC Iron Base in Austin, Texas with my preceptor, Dr. Nakra. And it's been an amazing 6 months. My background is in ophthalmology. And so I did my residency at UT Southwestern in Dallas. And then I'm doing an oculofacial plastics fellowship through ASOPers. And then am now in my 1-year AACS fellowship with Dr. Nakra.
Great, thank you so much. Dr. Sarah Feeney, is that correct?
Let me just change my name and my husband's name on there. But yeah, my name is Sarah Feeney. That'll reflect now here. Sorry for joining a little bit late, but I'm out here in Cottonwood Heights with Dr. Vincent, doing the general cosmetic surgery fellowship year. Started in July. So yeah, it's been about 4 going on 5 months. And my background is I came straight from residency, and I did my residency in obstetrics and gynecology at the University of Kansas in Wichita, Kansas. I'm originally from North Dakota, and went to University of North Dakota for medical school.
Great, thank you so much. And Dr. Christopher Hasted.
Hello, I'm Chris Hasted. I'm trained in oral maxillofacial surgery, and I was a facial cosmetics fellow at Aesthetics International in Atlanta with Dr. Bagari and Dr. Khan. I'm currently in private practice in Knoxville, Tennessee, but I'm going to be joining Vanderbilt Medical Center after the first of the year.
Great, excellent. Dr. David Henry.
Hi, everyone. My name's David Henry. I am lucky enough to be with Dr. Hayavi right now in Rancho Cucamonga, California. And I'm doing the general cosmetic fellowship right now. I am originally from Michigan, went to school in North Carolina, and then just finished my general surgery residency in Denver, Colorado. So it's great to be out here, and I'm excited to get things going.
Great, thank you. One of our program directors, Dr. Michael Klaska. Good to have you, Michael. You're on mute. Go off mute.
There we go. Good to see you, Jacob. I am a program director in Chattanooga, Tennessee at Southern Surgical Arts. I have 4 other partners, including Dr. Deal, Dr. Gardner, Dr. Summers, and Dr. Ray. And my background is a little bit different than everybody else here. I am general surgery boarded, plastic reconstructive surgery boarded, all trained out of Cleveland Clinic. And then in the old days, Jacob, you could do the experience route to get the cosmetic surgery board and fellowship credentials. So I did that, and then I was past president of the American Academy of Cosmetic Surgery in 2017. Was on the board of trustees for 6 years as well before that. And yeah, we have a great program in Chattanooga with tons and tons of cases. So if you're interested, just give us a holler.
Thank you, Dr. Klaska. Let's go to Catherine Laughlin.
Hi, I'm Catherine Laughlin. I am originally from North Carolina. I'm general surgery trained, and I did general surgery for about 8 years before deciding to move over into cosmetics. And I'm up in Chicago at their program. I'm the first fellow that they have, so we're sort of figuring things out, but they've got 6 different surgeons that I get to work with, and so far it's been really good. So,
what's your program director?
Dr. Trong, Anton Trong.
Great, excellent, welcome. And we have our program director, Dr. Tanuj Nakra, who always helps me with this meeting. Great to have you, buddy.
Hey, Jacob, how are you? Hope you guys can hear me okay. I'm in a loud environment, but can you hear me okay?
Yes,
Yep.
we can hear you.
Okay, good. Well, yeah, I'm a facial cosmetic surgery program director in Austin. You already met Karen Brown, who's our current fellow. Our program has about 6 to 7 preceptors. My background is originally ophthalmology and then oculoplastics. And then I did a cosmetic surgery fellowship on face and body. My practice is focused on facial cosmetic surgery. I have been kind of part of the AACS for the last 15 years since I was in training, maybe 18 years actually, when I think about it, time flies. I have served on the Cosmetic Surgery Foundation. That's actually, Jacob, where you and I met.
That's right.
And I've had the pleasure of coming to the meetings over the last 15 years. And I think one of the really wonderful things about this organization is the true multidisciplinary nature. Just in the introductions that we've just heard, we've got oromaxillofacial surgeons, general surgeons, plastic surgeons, we've got ophthalmologists, OBGYN. I think everybody brings something to the table. And at our national meetings, it's just incredible fun to share stories, trade notes with colleagues from around the country. And we also have our own individual organizations. I'm part of our Oculoplastic Society. I have to say that the AACS really wins the collegiality award when it comes to how everyone gets along. It's just incredible fun to go to the meetings and reconnect with colleagues who are actually true friends across the country. And I think that's been one of the best things about the AACS over the years. We're proud of our fellowship program. In our program, we train our fellows on the full spectrum of facial cosmetic surgery. And I know the other programs out there are excellent, and we're excited to tell you about our programs tonight and answer questions.
Great. Thank you, Dr. Nakra. And last but not least, Dr. White, Terrace White. Please introduce yourself.
Hi, everyone. I'm Terrace White, originally from the Dallas area. Did general surgery residency in New York City and then did a trauma critical care fellowship in LA. Worked for about 8 or 9 years as a general surgeon and have taken the dive and gone to the dark side here. I'm a fellow down in McAllen, Texas with Dr. Pablo Rivera at Cosmetic Surgery. It's been a great few months. Excited to keep learning and get started on my own.
All right, great. Thank you so much. So these are our panelists, and we had some questions sent in and some questions that we usually go over that are pertaining to this group. And I'll start with you, Dr. White, because you were in practice for a few years and then you came back to do a fellowship. And one of the questions that were sent by the registrants was any tips for somebody returning to fellowship after working for a few years, pros and cons. So you and I think Dr. Laughlin also can answer this question, right? Because you were in practice and you came back and you're doing a fellowship now. So I think they'd like to hear your perspective on how does that work?
Well, I was always interested in kind of aesthetics and cosmetic surgery, even finishing. It was more of a financial thing with me. A lot of the fellowships are unpaid. So I just, after all the training and time, and I didn't have much money from my parents helping me with the loans and stuff. So I kind of had to get to work. And finally, I was like, you know what? I love trauma, but I don't know if I can do this for another 40 years. And I kind of started going back and doing some of the cosmetic stuff, some of the non-surgical procedures, injectables and things like that, and got the bug again and decided to just pull the plug. The only thing I would say is it's hard going from being attending back to a trainee. Make sure you have the finances lined up. And thankfully, my program director allows me to do a little bit of moonlighting so I can eat. But definitely that's something to consider, especially if you have family and kids.
Great. Thank you for that perspective. Dr. Laughlin?
Yeah, I would say it's a little bit difficult from the financial standpoint. That's maybe the biggest difference. Going back to a resident salary after having an attending salary for about 8 years is just different. But if you save up, then it's not really that big of a deal. I think for me, I was always interested in some of the cosmetic stuff. At one point in my life, I was married to a plastic surgeon, helped him start his own practice. We were doing the oncoplastic, breast reductions and cancer surgeries. I was doing big abdominal component separations, and he was doing the tummy tuck and liposuction part. So I've been around a lot of it. And actually for the past couple of years, I've been working, doing liposuction with Sonobello. So I kind of eased my way into the cosmetics world. And before I said, yeah, this is what I want to do. And I really love it. And it's really a good choice for me. But I think, having some of those opportunities to kind of slowly get into it helped to bring you from that trauma acute care surgery mindset over. It's a little bit different, but
so I think a follow-up question is that this person asked, would it be possible to do this on a part-time basis? Because I'm in practice, I own my own practice, and I'll answer from my perspective after you guys answer from yours. What do you think? What is the pro of being in a fellowship full-time, immersed in it, versus trying to do this part-time? Do you have any feelings about that?
I think it would depend on the program director and how you went about it. I mean, if you were immersed in it 3 days a week and maybe did 2 years instead of 1, you would probably get everything that you needed. But I think you'd have to have some careful planning and be in a program that was willing to kind of work with you that way.
Right.
Jacob, I can weigh in on that a little bit too.
Sure,
because
go ahead, Michael. Yeah, go
yeah,
ahead.
we have 2 fellows that are doing that exact thing right now. 2 of our fellows, who equate to 1 fellow, are on 1 week on, 1 week off, and they're doing a 2-year program with us. And honestly, I think it's not a bad way to do it. And here's the reason why. Number one, it's a lot of stuff to learn in 1 year. And what happens over that 1 year time is that you get inundated with so much. I think some of the message gets lost in translation. Number two is as being able to go home and practice another field, general surgery, whatever it is, and then start to get your mindset and your product ready for development, i.e., cosmetic surgery in your own practice. Having that extra year and slowly developing it and going and applying principles from that you learned the week before is very advantageous. I've found that the current fellows that we have are actually progressing very, very well over a 2-year period, part-time versus a 1-year period fully immersed.
Okay. So I think majority of the programs are 1 year continuous. As you heard Dr. Kloska mention, there are a couple of programs that offer part-time, but from a program director point of view, on my end, I think it is better to do it continuously, full-time. I've had several fellows that had been in practice and came on, and then I have one now that after years of being in practice decided to do the fellowship because this is his interest. And I think if cosmetic surgery is in your heart and that's what you want to practice, you really should dedicate yourself fully to the profession, to the art. There is a lot to learn. There is a lot to know. And I think you get it faster and better when you're fully immersed in it. Now, is it not possible to do it slower in a 2-year program? Yes, of course. I mean, here's Dr. Kloska, doing it successfully with two fellows, and we've had other fellows that have done it part-time. But let's segue, and I'm curious as to know how people have learned about these fellowships. That's the whole reason we put on these programs, is because, not too many residents know about our fellowships. So I'm going to ask Dr. Bahraini, how did you hear about the fellowship opportunity?
So I'm actually, I feel like my situation was pretty unique in the sense that two of my attendings at my training program in Kansas City, Missouri, are previous AACS fellows, one full body, one face only. And then actually the program director of our program spent, part-time 3 years with the guy who did the full body stuff. And so he kind of had the experience of cosmetic surgery in his wheelhouse. And I really think that was almost, I couldn't have planned it better to be in the perfect place to not only learn about it, but also kind of be able to scrub into some of these cases with my attendings that residents typically aren't privy to.
Great. Let me ask Dr. Bawa, how did you hear about the fellowships? You're on mute.
Sorry.
Right.
I actually heard about the fellowship through one of my senior residents when I think I was a PGY, maybe end of my PGY 3 going into PGY 4 year, who was interested in plastics and then started exploring cosmetics. So because my senior resident was interested in both and in cosmetics is why I started to explore cosmetics, and I felt like it fit exactly with what I wanted to do.
Great. Excellent. And I want to delve into the people that we talked to that just came back into fellowship. So Dr. White and Dr. Laughlin, again, what did you hope to gain from completing this fellowship, from the AACS fellowship?
Well, I wanted a rigorous, trained program where I would have someone that would help me, like you say, immerse myself into the procedures. Because as operating for almost 10 years, you kind of know how to operate. It's just learning different procedures and new procedures, and they'll say it's just skin surgery, but I mean, there's a lot of not just technical aspects, but the pre-op, the intra-op, and the post-operative stuff. Things you don't even think about. And it's just nice to have someone that's willing to take you under their wing and almost like an apprenticeship. So being and attending, you kind of appreciate someone that's taking the time to teach you. And I think I just like the structure of the fellowship. And of course, you have Margaret, who's always helpful and has everything ready for you. And it just seems very organized, and it's just really easy for me to kind of apply what I've already learned and known into kind of my dream of being more focused on the cosmetic surgery part of surgery.
Great. So you would say, how does your experience compare to your expectation so far?
I'd say it far exceeds my expectation.
Great. How about you, Dr. Laughlin?
I think, well, I mean, I learned about the fellowship from one of my colleagues where I was doing liposuction, who said, you know, if this is really like you're good at this, you seem to really like it. If this is what you want to do, you should really consider this. And then I started looking into what the program was and realized that I could expand on things that I had already been doing. And so adding in some of the breast procedures and the BBLs and those things, those are all things that excite me and interest me. And so I really wanted opportunity and a program where I could go and I could learn these procedures from multiple different people, and to learn you know, really just how to do it. And also I'm planning on opening my own practice, and so to kind of have some guidance as I start in some of that process, and just making sure that, you know, that's also a great way to have a sounding board and resources for yourself whenever you're in a program like this. And I think it's definitely exceeded my expectations. I mean, I think I have something like 400 surgeries already documented, and I started in August. So I mean, I think it's just been really wonderful, and I think I'm definitely going to be prepared for what I want to do in the future.
Great. So some of the current fellows, tell me what has been your favorite procedure in your fellowship so far. And you can go ahead and...
Yeah, I can go. Serafini. I'd say that my favorite is mastopexy, because I found that was something that we did quite a few of right away, and it's something that we can both work on the same side and our respective sides, and get the patient out of anesthesia much quicker. And also, it's like you guys are kind of speaking to, it's not just surgery, it's pre-op, post-op, but it's also surgical markings, and there's a lot of art to it, and there's a lot of ways to do it wrong. So I think that it's something that each case I learn something a little bit different. And so that's been my, I'd say, most rewarding case thus far.
Great. Thank you for that. Dr. Brown, you want to chime in?
So I'm doing a facial plastics fellowship. So all of the surgeries that I do are, of course, on face and neck. I think this is a kind of two procedures, but I think that the brow lift and facelift they're my favorite. The brow lift was one of those things that when I first started learning it, I didn't know how I was ever going to be able to navigate that anatomy safely and confidently. And then it's just fun to see how you grow with doing more and more. So I think the anatomy is really beautiful of dissecting the temporal area. And so I love doing that. I also love being able to see the results of it immediately afterward. And I think it makes a huge difference for patients who have a lot of brow descent, and then opening up their eyes like that. I think that it's really a high reward sort of surgery. And then along the same lines, facelifts and just being in the anatomy of the face, it's something that translates really well into oculoplastics reconstructive surgery, helps get you more confident with dealing with that kind of complex anatomy. And so I feel like it prepares me really well to do reconstructive surgery in addition to cosmetic surgery, which is kind of something that I want to do a hybrid of both. So I just think it's really fun to see the transformation there.
That's awesome. Thank you for sharing that.
Can I chime in, Jacob? I'll just kind of tag team off Dr. Brown there. So, you know, I've been watching Dr. Brown progress, and I've had the privilege of training fellows for 15 years now. And it's really quite a privilege, I would say, as a program director, to teach students who are very interested, who come in
a little anxious about their progress, wondering how they're going to be able to build the confidence to really be a full-fledged cosmetic surgeon with the confidence to take a patient through the journey and make the right decisions along the way. And every single time, I see fellows showing up in July who are just quietly trying to absorb what's happening in the operating room. And as the fellowship goes by, watching them build skills, watching them increase their confidence and execute their own surgeries. Dr. Brown just recently did a couple of browlifts on her own with some really nice outcomes. At this point in her fellowship, just doing a wonderful job of being a primary surgeon on cases. It's really just so gratifying to watch that process occur and to see all the fellows blossom into the cosmetic surgeons that they will become. And so Dr. Brown's doing a great job. So have many of our fellows before. And again, Jacob, I know you experienced this, but it's such a privilege to train people. I feel very lucky to do what I do.
Yeah, absolutely. I agree 100%. It's it's enjoyable to see them progress and mature into very competent cosmetic surgeons. And like you said, by the end of the fellowship, they can do the procedures on their own confidently. They select the correct patients, the correct procedure, and you can see that all your work and effort has come into fruition. And I love seeing my previous fellows succeed at all the meetings. Dr. Ayeva is here, but we just went to a meeting in San Diego, and I've had several of my past fellows there. Some presented cases, some ran the meeting, and I'm extremely proud of them. It's enjoyable. Of course, that's the biggest satisfaction that we get as program directors doing what we do. And I know you love teaching, I love teaching, and I think Dr. Klaska, same, he loves teaching as well. So that's why we're in it.
And then, Jacob, another thing that has been really fun to be a part of this organization for the last 15 years is watching the whole specialty evolve and grow. So, surgery is not a stagnant art. Cosmetic surgery is not stagnant. We're constantly evolving and changing. And, I've known you, Jacob, long enough, and also Michael Kuska, where, techniques change. And that's the reason why in our fellowship, we, of course, are training on anatomy and safety and principles, but we're also encouraging our fellows and ourselves to employ a certain amount of creativity and open-mindedness when it comes to these surgical procedures. And as time goes by, we evolve. And you were mentioning how much fun it is to see fellows that you've trained from the past. What I really like is when our previous fellows come back and tell me years after they trained how they've evolved their own techniques and how they think that I should change the way I do X procedure or Y procedure because they found a better way to do it. And to me, that is incredibly gratifying. I've had fellows come and make suggestions that I now incorporate into the way I do facelifts and brow lifts. And so again, it's just the circle of knowledge in medical education is really kind of this endless loop where, we have the privilege of training fellows, but we're also learning from the process, and then they may literally come back and train us on techniques later.
Yeah, I agree 100%. And I'll say what's unique about our fellowships is that we do have this multidisciplinary, base that we can always rely on. Like, I call you or some other oculoplastic surgeons and Mike when I'm doing these deep plane facelifts, and we discuss things. And we have lots of different specialties that contribute to all the meetings, and that makes us stronger. I think that is the biggest advantage of having this type of training in this arena. So having said that, let's move on to the next question that I think people that are thinking about these fellowships want to know. What is the percentage of hands-on experience in your fellowship? And I want maybe some of the current fellows and the past fellows to talk to that. Maybe we'll start with Dr. Henry.
All right, yeah. So I don't know if I can give a exact number, but it's a lot of hands-on experience. From day one, you're in the operating room, and this is just my experience with Dr. Ivy. It's been great. You're in the OR, you're learning from day one, you're working hard. And then it's great because the more you learn, the more comfortable they are with you, the more they let you do, the more autonomy you get. And by the end, you should be capable of doing a lot on your own. And that's just in the operating room. And at least in our program, we do a lot in the clinic as well as and in the med spa we have. So once again, more we progress, we get to do a lot more. So you see follow-ups and then you see consults when you're more comfortable. And then they'll let you do injectables when they feel you're comfortable. It's a lot of hands-on experience, but it's not too daunting. It's a very good slope of getting to where you're supposed to be, and it seems to be a really good process at least from what I've seen.
Dr. Bahraini, you want to speak to that?
Yeah, I can pair what Dr. Henry said. I mean, I'm the first fellow of my fellowship program. I don't know if any of the other programs are like this, but Dr. Sanovich has been very hands-on kind of from day one. I've been doing my side of the facelift since towards the end of my first month. Like Dr. Henry mentioned before, I'm starting to see my own patients. I'm in every follow-up with him. Cases that we've done together, or cases that I do, learning how to manage these patients both pre and post-op. Because I think that's the biggest thing is being able to take that away, how to manage people's expectations pre-op and then manage any sort of delayed healing and everything once you complete the surgery.
Yes, and also learn who to operate on and who not to operate on, right?
Yeah, I'm still working on that one.
Yeah. All right. Dr. Baba, you want to say your experience? How much hands-on do you get in your program?
Yes, sure. So for my program, I'm fortunate enough to actually get quite a bit of hands-on experience. I would say from the get-go, definitely more than just a surgical assist. And by maybe month 2, I was doing majority of the surgery. And also my program, I'm fortunate enough to get, I would say on average, at least 5 to 6 cases a day, Monday through Friday. So it's quite a lot. And you're operating all day. I mean, you're operating from, 7 a.m. to 4 or 5 p.m. So, I mean, it's really great, a lot of autonomy. And it's been awesome.
Great. Thank you for sharing. I want to ask either the program directors or anyone on the panel, really, what advice would you give an incoming fellow?
I can weigh in on that, Jacob, a little bit. Again, I've been doing this. I've been in private practice for 25 years at some level, and have trained several fellows now. And a couple things I will tell you. Number one, I've noticed recently that the fellows coming into the program have, especially out of general surgery now, because of all the Da Vinci, all the robot, all the minimally invasive procedures, they're not as proficient with their hands and their suturing. So number one, I would come in and be well-versed in suturing. Number two is to know your technologies. And when I say that, I'm not just talking about lasers and injectables and those types of things. I'm talking more about the equipment that you use on a daily basis, your needle driver, how the needle works, what needle's good, what suture's good, what suture's bad. And I think that if you go around and talk to people like myself, Dr. Hammer, Dr. Hayavi, we would all sit there and agree at some level that it's really critical to know those little simple things in your technology. And then number three, come in with an open mind of learning and not come in and want to be a technician. I tell all of my fellows that you have to come in and be a clinician and be able to critically think and not come in and be a technician and a monkey. Because at the end of the day, if you don't make the right diagnosis, you will never have the right treatment and you will have poor outcomes. So for new people coming in, know that you have to immerse yourself. Like Dr. Hayavi said, I mean, it's extremely important to immerse yourself and understand that, at least with me, and I think probably the older guys out there doing the training, I'm a little bit more merit-based. If you show me, you know, the details of anatomy, and you have read and you understand the basics and concepts, then you will progress and get more and more hands-on to be able to do complete cases.
I agree with that. Any other advice from the panel to an incoming fellow?
I'll just make a small comment to echo what Michael just said. You know, I think that one interesting aspect of the AACS fellowships, as it's very apparent from the stories you've heard today already, is people get to these fellowship programs through various pathways. Some people end up in mid-career making a shift, but at the end of the day, those individuals who are doing an AACS fellowship are doing their final training for the rest of their career. And so that time in your fellowship is so critical that every moment of that year or whatever the period is that you're training, you should be doing all you can to totally imbibe everything possible from the experience, from your preceptors, from your patients. And it's not just like a 9-to-5 job or 7-to-5 job. You have to fully immerse yourself. I know I'm repeating the phrase, but it's so true that the evenings should be used to prepare for cases that are going to be happening the next day, review cases that have happened before. If you missed a post-op because you're in the operating room, go check out the charts to see what happened to that patient that you were a co-surgeon on a week or two ago. Learn from every single patient, because you'll be thinking about your experiences in your fellowship for the rest of your own career, trying to recall those details. I'm 15 years, 18 years out of my training, and I still think back on moments that happened during my training. And, that year will shape you the rest of your career. So fully drink from the fire hydrant for the entire time that you're training.
Excellent advice. I've been a fellowship director for 18 years and finished my own fellowship 23 year ago. And I agree 100%. The year, whoever is thinking about doing this, obviously you want to excel and you want to do an additional year of training because you want to gain more experience, more knowledge in this arena. So that year goes by fairly quickly, and try to learn as much as possible. And it's not just the surgery. You heard some of the current fellows, people that have been in practice. You need to learn not only the surgical procedure, but management. You need to learn, what does it take to have an accredited surgery center? What does it take to, manage staff properly? What does it take to recognize, patients you should not operate on? I think that's more important than operating. So there's a lot of important things that you need to be aware of, and you have to learn it all in this year. But I think this is the correct arena to learn it in, and I'm gonna segue into asking some of the past fellows, maybe, what do you think was the difference between your fellowship and a hospital-based training that you came from, right? And what was the most difficult thing you had to battle through during your fellowship, and how did you get through it? So it's two separate questions. I'll start with you, Dr. Ayeva. Tell me, what did you have to battle through, and why do you think the fellowship, or how was the fellowship different than your previous training or any other training in cosmetic surgery that's hospital-based? Why did you choose this one particularly, this arena?
These are great questions. I'll start with what was the hardest part of fellowship. Retaining all the information, being present, being there every day. It's not, a residency program where there's 15 people. It's you and your fellowship director. So you are present and you're responsible. So it's simply just keeping the energy up, being present and retaining as much as you can. It was a lot of information in 1 year, but again, it was an excellent training experience. And then the difference between residency and fellowship, I mean, I'm general surgery background and general surgery in New York City, which is very malignant. So it was a very abusive environment. Honestly, didn't learn much besides the abuse. But it's a residency program. There's a lot of people, there's hierarchies, there's all these tasks, there's all these cases. It's different versus Dr. White called this an apprenticeship, which is such an appropriate word. You're spending one-on-one time with someone who truly cares about you and truly cares about you succeeding. And I think that in my fellowship, I was able to flourish in this one-on-one space where someone was telling me, you are doing this correctly and you're able to do this well. That's positive feedback versus in my experience with general surgery, it was mostly negative feedback that I was getting. So I think that the fellowship program was incredible, and it's very specific to, something that you desire. You desire to do cosmetic surgery, and it affirms you on a daily basis. Obviously, if you didn't want to do cosmetics, you wouldn't be in this fellowship. But I think that this program, being a one-on-one experience, makes it a priceless, experience. And even now in private practice, I still think about everything Dr. Hayavi said on a daily basis when I'm looking at patients and doing consultations. I'm trying to choose the right person. So once in a lifetime experience, a lot of information, but it's truly valuable.
Dr. Henry, do you want to respond to the same question? How is this? Why did you choose this and not a hospital-based training? And what has been the most difficult or thing that you had to battle through so far during your fellowship?
Okay. So this is very different than the hospital. So coming from general surgery as well, like Dr. Way was just saying, it's a little different when you're in the hospital all the time. You see a patient in the ED and then you take him in the operating room, you never see him again. In the outside, in cosmetics, it's nice because we learn to build this continuity of care with our patients. We meet them, we build a repertoire, or we build a relationship with them, and then we operate on them. We see them post-op, and we follow up with them like weekly, and we get to know them very well. So it's a very different world in that respect, and you get to really get to know your patients, and it's very different than what you learn in residency. So I think the hospital and the outside world are a little different. Plus, you learn how to manage things differently when it's outpatient versus inpatient. So that was a little something different. And one of the hardest things about switching, I think that might have been part of it, is you just kind of switch this from being all in the hospital and then where it's a difficult experience sometimes, especially in residency. Like she was just saying, fellowship or residency can be tough and they don't care as much. And then you come to this world and people want to help you, and it's a more caring world. And it was a little bit of an adjustment at first, but it's very rewarding in the end. And I think it's been great so far.
Great. I'll ask Dr. Hostet as well to comment on that as a, past fellow, right?
Yeah, I've been out of fellowship about 2 years now. It's completely different than residency. I would say that it's a lot less fast paced. The days are shorter, obviously. It's more 7 to 5 rather than 5 a.m. to, midnight. Being oral facial surgery, we didn't get days off after call and all of that. What was the second question?
What did you have to battle through during your fellowship, and how did you get through it?
Yeah, that's a really good question for the fellowship that I did. So my fellowship's a little different because I had a program director, but I only saw him in the whole year maybe 2 times the whole year. The rest of my fellowship, I was with surgeons in plastic surgery, oculoplastics, ENT, oral surgery. So every single day I was with a different surgeon. And so I would say that the biggest battle that I had in my fellowship was we didn't have access to their charts, so we didn't know what was upcoming the next week, as far as surgeries go. So if we were lucky to have, to get access to it from one of the scrub techs or something, it was kind of hard to study ahead. So I would say that was kind of the biggest battle with my fellowship, was just not knowing what was going on until I showed up that day.
Oh, wow. That's kind of unusual.
Yeah, it's very different than, I think most of the other fellowships where you're with a program director and that's kind of who you train under. Now it
Right.
was because I saw a bunch of different ways of doing it. I saw how plastics did it different than ENT, did it different than oculoplastics. So that was wonderful. But um, I think being on top of things, and um, I think as Dr. Clothgood said, read ahead, study ahead, and all of that. Very, very important, especially in like my type of fellowship where every day was different with a different surgeon.
Yeah. Very interesting. So there's different types of fellowship. I think most of the fellowships, there was a question of how many physicians, how many physicians do you learn from? And it varies, there's, as you can see, some of our fellowships have 2 or 3 attendings. Some of the fellowships have 12 attendings, so it can vary. In terms of stipend, what type of stipend is provided to the fellows? That also varies. These fellowships are not ACGME funded. They're not ACGME accredited or funded. So what that means is they're privately funded. So most of the salaries are like a resident salary, and every program director decides on their own what they're going to pay their fellow. But they also offer, a lot of the fellowships, I think, offer opportunities to make money, meaning doing other things that can produce income for the fellow. There was a question about moonlighting. Is it possible to moonlight? I'll make a general statement that, we allow moonlighting as long as it doesn't interfere with the fellowship activities. I don't know if any of the current fellows moonlight or want to comment on that. You're welcome to comment on that. Does anyone? I know Dr. White said something about moonlighting. Do you want to comment on it?
Yeah, so I'm in an unpaid fellowship, so understandably the program director is super nice, and I mean he's the same way as long as it doesn't interfere with anything from the program. So I don't miss any surgery days or clinic days. Just a weekend or two a month. Lets me do that, and I don't think it affects my training at all. But it allows me to help keep up with the bills.
Okay, great. Anybody else moonlight in the other fellowships, current fellows? I'll tell you, in my experience, most of the fellows who come in, and I tell them this, it's only a year, and it goes by quick. So most of the fellows that come in want to concentrate all of their efforts in the fellowship. So very rarely some of them would actually venture out and moonlight. I've had some fellows that did it, but majority of the fellows are 100% dedicated in their time to the fellowship. Let's see. There have been other questions asked. What is the match rate of applicants? I think that was a pretty good question, and Margaret provided some numbers. So this past year, for the facial programs, our match rate was 55%. And for the general cosmetic surgery program, it was 69%. But it varies from year to year. So the year previous to that, the match rate for the general cosmetic surgery program was about 80%. So it varies, depends on what's going on. Let's see, another one for program directors. I think this is important. Could you please discuss what makes a competitive applicant for a fellowship? Dr. Nakra and Dr. Klaska, you guys alluded to this, but you can go into detail on it.
Sure, I can start. We're looking for applicants and candidates who not only are show surgical skills and have excellent recommendations and have had excellent training up until the point of applying, but we're also looking for people who are just good human beings that'll fit into our practice and we'll enjoy having around for the time that they're training with us. And something that's very important to us is that we feel proud of our program, and we feel that And most of us in our practice feel that our fellowship program far exceeds the quality intensity of our own fellowship programs when we train. And so we feel that there's such a, the universe offers a gift to a fellow who's going to be training in any of the AACS programs, including ours. And so, we have expectations for what that fellow will do with their career. We expect that they will not only be an excellent surgeon, but they will also contribute to the specialty. We want them to be involved with some sort of academics. We're in private practice, so we don't have any traditional concepts of what that means. They don't have to be at a university, but that means publishing, that means teaching at conferences, that means remaining involved in your specialty, and giving back to the system that has given so much to you. So that's what we expect.
Great, thank you. Dr. Klaska, you want to chime in on that? What makes a competitive applicant to your fellowship? You're on mute. Can't hear you, Michael. Okay, well, Michael, we can't hear you. So I'm just going to chime in myself a little bit. I think I'm going to echo what Dr. Nakra said. When we interview candidates for the fellowship, all the candidates are pretty much, well qualified. But what we're looking for is somebody who's eager to learn this art and science of cosmetic surgery, someone who has a good personality that fits in to our family. Really, I mean, all of our fellowships are an organization and a family. We spend a lot of time together. I mean, I'm in my office 12 hours a day. My fellows know that. And you learn not only from us, you learn from, I have two other surgeons with me in the practice. We have faculty. We are affiliated with Loma Linda University, with UCLA Jules Stein, with very competent cosmetic plastic surgeons in Southern California. So you have an opportunity to spend time with other surgeons to learn. But we want people that are eager, that are interested in the specialty and want to practice and flourish and contribute back to the specialty. We want all of our fellows to become board certified. That is a must. And we want all of them to be involved in the academy, to be able to teach, to promote, to advance the specialty. I think that's very important. As Dr. Nakra said, I mean, this is a dynamic specialty. It's exciting because there is constantly new technology, new information, new ways of doing things. I mean, I've been doing deep plane facelifts for 23 years. Is my deep plane facelift the same as 23 years ago? Not at all. I mean, only even in the last 2 years, it has changed a lot because we constantly learning. We learn from each other, and the technique develops. So we want people that are serious about this, that are going to be, intense and involved and want to contribute once they're done with their fellowship. I think that's very important.
Jacob, I apologize for the mute thing. What both you and Dr. Hammer have said, I echo 100%. I think one of the most important things, though, that we look for is a fellow that, and bear with me here, I'm kind of a little bit old school, but if the fellow doesn't have self-respect in everything they do, they aren't going to gain the respect of us and or the staff, and you will never gain the respect of the patient long term. So when we interview, we're looking for your self-respect. We're also looking for you to realize that essentially in 1 year, we are giving you the keys to the kingdom. If you think about it, there's not a better field to be in the surgical arena than the dynamic field of cosmetic surgery. It changes like the iPhone. As soon as you get an iPhone, you're already behind. And it's a cool field. But if you can't give it your undivided attention, and understand that you for 1 year are committed to the attendings, the fellowship directors and the staff, willing to turn over the room, willing to mop the floors, willing to do whatever it takes to make that patient's experience good and your surrounding team members have a great day. This probably isn't the field for you, because we are all one family. And then lastly, again, giving back. My kids have all played high level sports, and I tell them at some point in time you have to give back to those little kids looking up to you. So, and we do the same. That's what Dr. Hayavi and I are doing, Dr. Hamra and I are doing. We're giving back right now, and we expect you then to want to do the same on the backside of this as well.
Great, thank you for that, Michael. There's a couple of more questions that were sent that I want to cover. Somebody wrote, does a general cosmetic surgery fellowship prepare you for facelift, rhinoplasty, and blepharoplasty, or does one need to focus on facial cosmetic program to be proficient? Let me have our fellow Dr. Henry, and I don't know if Dr. Ido is on, our current fellows respond to that, or any other general cosmetic fellow that's doing a fellowship currently or have done it previously.
Okay, yeah. So it's Dr. Henry here. So we do, in our practice, at least Dr. Have, we do a lot of everything. So I can't really speak for every general cosmetic one, but for us, we work with Dr. Tower, one of his partners as well, and Dr. Ryan, and they do a ton of body. So we do a lot of breast and a lot of weight loss patients, liposuction, we do everything. And Dr. Javi also does all that stuff, but then he does a lot of face as well. So I actually am very interested in the face. I like everything. So it's been great because right now I'm getting facelifts like weekly, and he does rhinos all the time, and we do blephs all the time. I mean, we get a good mix of everything. To graduate, I think we need at least 50 cases in the facial world. I know I already have over 50 or 50 procedures, sorry. So I checked, I already have over my max that I need for general, but I like it. So we're gonna keep getting more, obviously. So obviously I don't think we get as much as the facial fellowships, but we still get a good amount.
Yeah, this is Dr. Ido, Dr. Javi's other fellow. I'm currently on his service, and just to echo what Dr. Henry just said, I think it probably varies by program. At least in our program, we get a tremendous amount of face, and I think what it comes down to is you express interest in things, right? And you see a lot, and I think for some people you'll need less cases to feel comfortable, and for some people you'll need more. And your program directors that are involved will be there and be able to say, look, I feel like you're strong and you can do these cases. You've done enough. We've had a previous fellow, Dr. Jones, a year ago. He's out doing facial cosmetic surgery and body, and he's doing quite well. So I think it just comes down to your own skill set, your comfort level with the face, and then just approaching your program director early if that's an interest for you in a general cosmetic body program, and seeing where that goes. And I think certain fellowships have more volume in face than some others. So I think that's also something to keep an eye out for in selecting a program.
Great, thank you. Anybody else in a general cosmetic surgery program that wants to comment?
I'll comment on that. I'll say, look out to see what the background is of the different programs that you're interested in. And Dr. Vincent, he is oral maxillofacial trained, but I'm doing a general cosmetic surgery fellowship. So we absolutely get a lot of face and rhinoplasty. And then look at their websites and Facebook and Instagram and see what they're promoting, see what procedures they offer. And it's definitely going to vary from fellowship to fellowship in terms of locations and practice, and just kind of look into that and plan accordingly and strategically.
Thank you, Sarah. Okay, I think we covered most of it, and we're coming almost to the end of the program. Let me see. Let's ask post-fellowship questions. What kind of job opportunities are available after completing the fellowship? Are there any limitations? So I think Dr. Ayeva and Dr. Hasted can comment on that. You guys are post-fellowship. And
I've tried different kinds of jobs, actually. Straight out of fellowship, I joined a practice as a partner. There was maybe 6 different surgeons, 8 different cities. That was the first job. It was in New York City. During that time, there was a weird law that was passed in New York where cosmetic surgeons were limited from doing liposuction, but the American Academy of Cosmetic Surgery responded immediately and filed a lawsuit and removed that barrier in New York City. That being said, depending on what part of the country you're in, you may or may not experience prejudice in the hospital if there are plastic surgeons there who are trying to stake their territory. I've joined Sonobello as well to do part-time work there and do liposuction, and that enables me to work all over the country because they're everywhere. So California, Virginia, New York. And then I also have a private practice. So I work in surgical centers around the city, and I haven't had any problems, working with people. There's a variety of opportunities, private practice, join a group, join a big corporation. There are a lot of opportunities, and you will notice when you look online for jobs, whether it's Indeed or the American Academy of Cosmetic Surgery, these job listings are starting to be more specific. And they now say looking for a plastic surgeon and a cosmetic surgeon. So they're recognizing that we are available and they put it in the job listings. And if you Google it, you'll see a lot more people are using specific wording for who they're looking for.
great, thank you. So I'll say that unless Dr. Husted, you want to say something different in terms of your experience?
I was just going to say, I'm oral surgery trained. So I've been in private practice since my fellowship ended. And the 2 practices I've joined are very excited about having cosmetics as part of the practice. But I'm going back into academics. I'm joining Vanderbilt after this, just because, I think for my field, and there's not a ton of oral surgeons that are cosmetics trained and fellowship trained and then boarded with it. It's kind of hard to find a practice that's going to put a bunch of marketing power into the cosmetics when that's not been a part of the practice in the past. And so I've done a lot of pavement pounding with aesthetic centers, med spas, all of that, getting acquainted with the nurse injectors and such. That, for me, it's been kind of difficult. But going to a training program that kind of values the cosmetic end and is willing to put the money where their mouth is, I guess, as far as like the lasers and the surgical tools that we need. But
yeah, great. Thank you for sharing that. So I've trained, I think I'm on fellow number 24, and we've had a variety of, job opportunities for the fellows. Some of the fellows have been recruited to other group practices by plastic surgeons and cosmetic surgeons. Some of the fellows joined older cosmetic surgeon that wanted to retire and bought them out and are very happy. Some went back to work and a lot of fellows, I have to say, were recruited by companies like Sonobello, and they worked for them for a year or two and then moved on to opening up their own practice. Is it hard to open your own practice right after fellowship? I think it is. It's challenging. It's not easy. But one of the advantages of doing the fellowship with the academy is that you see what it takes to run a practice like this that's successful. So all the fellowship directors have a very successful practice. They're busy. They are, well versed in what it takes to survive, and so you can get an insight not just into the actual surgery, but how to manage the industry. So I think that's another advantage of doing the fellowship in this arena. I think we're out of time. I don't know if there were any questions. Were there any other questions that I needed to answer in the chat, Margaret?
There was one about international, uh, whether international surgeons can participate and whether our fellowships are accredited with a university or hospital. And I think it's easy to say that no, we are not. As we've all discussed, they're private practices.
Right. I mean, we have a handful of fellows. I mean, I know LSU, one of the fellowships is affiliated with LSU, but majority of the fellowships are in private accredited surgery centers, private practices, which is really the arena where cosmetic surgery happens. The cosmetic surgery does not happen in a hospital. That's a rarity.
Mhm.
Yeah.
We do have another one that says, what would you suggest to an applicant if they do not have any significant connections or mentorship?
Can I comment on that one?
Sure.
Sure.
I mean, I'm speaking from personal experience, but I would attend the AACS conference. Even if you have no connection to cosmetic surgery. That's what I did as a PGY3 resident. I didn't know anything about it. I just Googled cosmetic surgery. And in that one meeting, I met Margaret. I met Dr. Hayavi. I met a lot of surgeons. I asked a lot of questions and got people's phone numbers. And as a result, I met people and visited Dr. Hayavi and got a fellowship, and also, learned a lot and try to find people in my city or travel to them and do a weekend and learn. So even if you don't know anything about it, come to the meeting and see how friendly we are, and then get mentorship from there.
Great advice.
Can I also comment on that?
Yeah, please.
One thing that I did, because I didn't know anybody that had done fellowship or anything like that, but there were a couple programs that I was really interested in. And so I went and visited I shadowed the program for a day or two, just so that I could kind of see the program, but more importantly, so that they could see me, that I was a hard worker, a go-getter, a lot of the things that Dr. Kluska was talking about earlier. So just kind of putting a face to the name.
Right. And in terms of the international, applicant for the fellowships, I think, you have to be licensed in the US to be able to do this type of a fellowship, because it is a hands-on fellowship. It's not an observational fellowship. Because you have duties to the patients. You have to be, licensed in the States, and you have to be able to obtain malpractice insurance. Otherwise, it's not practical. I know some oculoplastic and facial plastic programs take international students, but I think most of those are observational. They're not actually doing surgery. With these fellowships, most of our fellows are hands-on, and they have to be able to operate, so that's the limitation there. Let's see. Are AACS resident members able to attend the conference for free? Margaret, that's your department. I don't know.
No, they are highly discounted, and it is the cheapest price right now until December 27th, and then the price goes up. It's in New Orleans, if that's if that makes a difference. And it really is. It's a great experience. I think it's a great place to start learning and building your network of support.
Right. We just had the California Academy of Cosmetic Surgery meeting in San Diego, and we had residents there, and Andre was there, and we had a resident from Philadelphia attending, and it's great. You come, you learn, it gives you information, it opens your eyes to the specialty, the society, and you get to meet people and make connections. So definitely doable. All right. I think this concludes the program. I think we're a few minutes over, so sorry for being a little bit long, but thank you everybody for participating. Thank you all the current fellows, past fellows, Dr. Nakra and Dr. Klaska. I really appreciate everybody, and thank you, Margaret, for putting this on.